College of Public Health at the University of Nebraska Medical Center, we recognize that a disease anywhere is a disease everywhere, and we need to educate our students and develop novel solutions to help the planet respond to a diverse set of public health threats, whether those threats are deliberate in nature, whether they're natural disasters, whether they're pandemics, or whether they're the routine occurring infectious diseases such as from SARS or from Ebola.
The Center for Biosecurity, Biopreparedness, and Emerging Infectious Diseases is something that I usually describe to people as an umbrella within the College of Public Health. It's an actual center that was approved by the Board of Regents of the Nebraska University back when the College of Public Health was first formed. And under this umbrella, I usually try to describe it as containing three different pieces. One of those components is the Center for Preparedness Education. The second component is the academic programs that we've offered for the last 5 years or so. And then the third component would be Dr. Phil Smith's affiliation with the Nebraska Bio Containment Unit.
The Center for Preparedness Education came out of funding to prepare for bioterrorism, and it sort of morphed into a Center for All Hazards Preparedness. The center was a joint effort between Creighton and the University of Nebraska. Back when it was formed, the chief medical officer for the state decided that both Creighton and the University of Nebraska should come together and use all their resources to help the state prepare.
The Center for Preparedness Education's mission is really to enhance community resilience through affordable preparedness education. Traditionally in the past, target audiences have been toward first responders, which are police, fire, and EMS. The new progressive approach is whole community, and that's recognizing the role that local communities have in preparedness and preparedness education and response. And those are healthcare, it can be community members, anyone who would be affected in a disaster, we would target for our programs. What's unique about our training and our training center is that we have a collaborative approach with our training and exercises and consultation where we can provide customized training to our constituents.
The Northeast Nebraska Public Health Department has responded to 5 disasters since 2013. In October of 2013, we responded to the Wayne tornado. In 2014, we responded to 2 tornadoes in our health district. And in 2014, we also had a large infectious disease outbreak. And then in 2015, one of our counties had an outbreak of avian flu. There are 4 components of emergency events. One of those components is planning. Another component is a response, recovery, and then mitigation and improvement plans. The Center for Preparedness has been a great partner in helping us during the planning phase and then also during the mitigation and improvement plan phase, where we are working with them to develop our improvement plan after these emergencies so that we can again move into the next disaster more prepared.
The Ebola Assessment Hospital training was really a collaborative approach during the fall of 2014 when Ebola was at the height of response within the United States. And we worked with Nebraska Medicine to help them train responders and hospitals across the nation.
The Nebraska Bio Containment Unit was conceived as an idea in 2004 in response to the 2003 SARS outbreak. So we wanted a place where we could take care of highly contagious individuals with dangerous diseases and still protect our staff. We have shifted our focus to education, and that fits very well with the Center for Preparedness Education's mission as well. They've helped us put on the courses with the many participants we've had in over the last 6 months. They're experts at innovative educational techniques, so they're good at distance learning and other things we've been able to employ. They've helped us train our staff for our Biocontainment unit.
I think the future of the relationship between the Association of Healthcare Emergency Preparedness Professionals and the Center for Preparedness Education is that we continue to collaborate on training and best practices. One of the goals of AHEP is to make sure that people in the field have the best available information, have the best available training, and that's right in line with the goals of Center for Preparedness Education. So we'll continue to work closely. I think we'll strengthen our relationship. I think we will continue to advance this field.
Center for Preparedness Education would really like to grow its training and education and collaboration, consultation through additional training outside of the state of Nebraska. We've proven here in the state of Nebraska to be experts with highly infectious disease response, and we have the expertise here, not only within the United States, but also globally. Global health has been huge, and we've seen how that's impacted the United States.
And now we have lots of different avenues of expertise, and from hospital preparedness to disaster life support, and multiple employees that make the center broadly accessible to people across Nebraska and even outside Nebraska.